hospital in Little Rock is the first in the state to use a device to transport donor hearts for transplants. In tonight's Health Check report, we're going to show you how it works, plus the story of one patient who just received a new heart. Waikoyan Carter has been dealing with congestive heart failure for a better part of a decade. He's had mechanical pumps, or LVADs, helping his heart circulate blood. While those devices extended his life, he was unable to do the things he loved.
I always loved water and swimming and just being free, you know? And then it's like when you have something so small like that taken away, you're just like, I don't really know how to feel. Carter recently started to develop complications and was hospitalized for 3 months in the ICU.
In his situation, one of the grafts connecting heart to the rest of the body developed narrowing that slowly imposed congestive heart failure situation again on his heart and his body.
When his condition improved, Carter's team of doctors decided to proceed with a heart transplant. It's a well-coordinated process that starts with identifying a proper donor.
You can create some antibody that will reject certain type of donors, so this has to be taken into the equation.
Once the decision was made, doctors traveled to the donor site with this device, the Paragonix Sherpa Pack. It replaces cooler and ice systems that have been used historically.
This is very new. Like in medical terms, this would be like a brand new device. It's a temperature controlled cooling mechanism for the entire heart. So that's the unique thing about this particular device.
Baptist Health is the first transplant center in Arkansas to utilize it, and they're still learning how the technology is improving patient outcomes.
That's a great question because all the results are coming out in almost real time. Certainly there's a trend towards better organ preservation with this device. We're at the forefront, really, of what's happening in heart failure. And not only are we at the forefront reading about it and dabbling in it, we're actually actively using it. Every single transplant we've done this year has been procured on this particular device.
Now that his transplant surgery is complete, why Carter is hearing a heartbeat for the first time in years.
After 10 years of just going from a vibration to a hum to feeling the thump was shocking.
The smallest things for him are now the most important.
If you ask anybody in the hospital, the first thing they'll tell you is, I want to go swimming.
His lifelong journey of being a transplant patient is only beginning, but Carter and his doctors are optimistic.
Living with a transplant is not a cure. It is a part of the management of chronic congestive heart failure.
You having the ability to try again thanks to someone else is really nice.
And for more about the Baptist Health Heart Failure and Transplant Institute, you can call the Baptist Health Health Line. It's 188-BAPTIST.